Se- Senator Husted.
Thank you, Mr. Chairman. Dr. Means, thanks for being here today. I'm going to try to get through pesticides and mental health for our children, if I could. I want to thank you for what you're trying to do to raise awareness about healthy eating, healthy foods. And since your nomination, and though I've had a lot of questions from farmers in the agriculture community in Ohio about your comments on pesticides. And you will not regulate pesticides in your role, but your views will impact American consumers and what they believe about what's healthy and good for them. What is a pesticide? I would just put a little poster up here, and why do we use them? Because this is the kind of thing we try to prevent. This is an earworm. This is the kind of thing that destroys our crops in all across the country. Corn, wheat, soybeans, fruit, and vegetables. If we fail to use proper pesticides, it will drive down yields of 20 to 50%, even more for fruits and vegetables, the very things we want people to eat more of, which will restrict the supply chain, make food less accessible and more expensive if we can't have proper crop yields and use more land, more resources, et cetera. And so given all those facts and given what the concerns are, please just share your views on pesticides for what they mean to the average consumer of food in our grocery stores.
Thank you, Senator Husted. And thank you so much for meeting with me prior to this hearing. This is a very complex issue. And what I would just want to start by saying is that I have the utmost respect for the American farmer. And I think just like doctors, farmers are in an impossible situation right now. Where we have developed an agriculture system that is dependent on chemicals that are toxic to have an affordable food supply. And that's not good for farmers, it's not good for consumers, it's a complex issue. And obviously changing anything overnight would be devastating to the American farmer and the American consumer. With that said, this administration is committed to understanding what's in our food and how it's affecting our bodies and how cumulative exposures to various chemicals in our environment is affecting us. And that is a core, profound, long-term, deep passion of mine as someone who thinks about how our environments and the system that we live in is affecting our health in the midst of this monumental chronic disease epidemic. And certainly pesticides, herbicides, insecticides is something we need to look into as part of that cumulative exposure. So it's a complex issue. It's very sensitive for farmers and for American consumers, especially mothers, because we want to have the safest water and the safest, food supply in terms of what's on it. But I understand the nuance of these issues and that changes need to be made thoughtfully with full respect for American farmers and the constraints that they're under. And also, eventually, we are going to need to move towards a more sustainable way of growing our food that decreases our reliance on toxic chemicals that are hurting human health. I think there are incredible movements happening within the administration. Like I mentioned, the $700 million going towards regenerative agriculture transitions, precision agriculture, and the private sector collaboration that may be using technology to help be more precise with pesticide spraying. And I think those are all positive developments. But at the end of the day, we do need to understand how these chemicals are affecting our bodies and work towards creating the safest
Great.
food system.
I have one more, three quick questions for you. It's on mental health of our children. And I'm going to ask all three of them and give you a chance to respond. Do you believe that smartphones and social media are negatively impacting the health of America's children? What age should a child have access to a smartphone and social media, and what would you recommend? Would you recommend banning smartphones in America's schools?
I believe that the research is showing that the impact of social media on children is profound and negative, and we need to take great efforts to protect children from premature use of technology that is associated with mental health issues and depression, and it's a strong concern of mine.
And at what age does the research say that we should have, give child access to a smartphone?
I don't have the answer to that question. I don't know if that an exact number is known, but I think in light of how quickly things are moving with technology and social media and how rapidly things are changing, we need to, as parents, communities, schools, and a government, exert an abundance of caution and be very proactive about making sure we're protecting children and their mental health.
I hope you'll spend some time talking about this issue in your role as Surgeon General, because if you go to a school that's banned smartphones, they will tell you it has a profound
Absolutely.
difference on the mental health and the educational environment in those schools. So thank you
Thank
for
you.
being here.